Thank you for taking the time to participate as a member of this important review committee. My name is Krista Beckwith, and I work as a maternal health specialist at the Colorado Department of Public Health and Environment. My work includes overseeing the state's maternal mortality work, as well as overseeing work on perinatal mood disorders during pregnancy, including pregnancy-related depression. We are partnering with the Communicable Disease Epidemiology section on this project. So a quick overview of what we'll go through today. We'll go through the ACOG Maternal Influenza Review Program that we'll be doing, that Colorado is participating in. We will go through a description of the FIMR methodology, the purpose of the case reviews, the role of the case review members, and expectations for the day. Colorado is participating with the American Congress of Obstetricians and Gynecologists to conduct a pilot project reviewing cases of pregnant women in Colorado who were hospitalized with influenza during the 2012-2013 flu season. For the purpose of this project, an influenza case includes those pregnant women who were hospitalized at any stage of gestation with a chart-documented diagnosis of influenza. Immunization status does not matter, so they may or may not have been immunized. This project is funded by the Centers for Disease Control and Prevention through the Association of State and Territorial Health Officials. This pilot project will provide a tested model and strategy that can be offered to any state that wishes to review maternal hospitalizations for influenza. So the goals of the project are to identify preventable issues and barriers that contribute to morbidity and mortality in pregnant women that result from seasonal influenza. This could include system failures, vaccine hesitancy, patient concerns around vaccination safety, communication errors, things of that nature. Additionally, we will develop recommendations to prevent future hospitalizations due to influenza among pregnant women, and we'll consider ways to implement some of the recommendations either during this project or beyond. All recommendations will be focused on the population and system level improvement. Colorado will be providing ACOG with a final report outlining the process and recommendations made. The overarching outcome of the work is to improve the general health for childbearing women and their infants and the development of national policies and systems to increase flu vaccination coverage among pregnant women. So this project will be using an adaptation of the Fetal and Infant Mortality Review methodology, commonly referred to as FIMR. The original FIMR methodology, which is an evidence-based process, has been used to monitor, assess, and improve services and systems for women, infants, and families where a fetal or infant death has occurred. Over the past several years, FIMR has been adapted to review other types of maternal events, including the review of cases of women with HIV infection. So the FIMR process includes information gathered from medical and public health records, plus a maternal interview, plus recommendations that are made by a professionally diverse case review team, and all of that combined is used to develop actionable recommendations for the improvement of systems and services that are then implemented into communities. The medical information and maternal interview are combined into a de-identified case summary for the case review team to read. Case identifiers have been removed, so the review is not about the medical facility or specific providers. Instead, the focus is on the care the woman received and what systems level improvements can be recommended to prevent future hospitalizations for flu during pregnancy. So Colorado also currently operates a maternal mortality review committee that reviews cases of maternal death that happen either during pregnancy up through 1 year post-delivery. This existing review committee operates quite similar to how the cases for the maternal influenza review program will be reviewed. We will be incorporating some of the processes that we use with maternal mortality as well as the facilitation model into this project. So the purpose of reviewing cases is not to find fault or blame or to conduct original research. Population-based literature exists for this purpose, and information collected about individual cases will likely not fill requirements necessary to contribute to the scientific knowledge base. The goal of the review is to focus on preventing future hospitalizations for influenza among pregnant women. This process allows for a continuous springboard for improvement in services and resources. Examination of cases can reveal where earlier interventions either succeeded or failed. So the case review summary form. The case review summary form is developed. You'll have one for each of the cases that you'll review. It is condensed into a summary that highlights the most important data from both the data abstraction and maternal interview. Each section is organized in the same order, so topics such as prenatal care are consistent across all the case summaries that you will read. So you will be able to compare case to case by topic. You will get the cases that we'll be reviewing by Friday, June 20th. Please review these case summaries prior to the meeting so that we can use our time together to actually focus on the discussion and not on reading the summaries themselves. I have also included a sample summary that was provided to us from ACOG just to give you an idea of what you should be expecting by June 20th. So the role of the community review team. The committee is comprised of a multidisciplinary group of professionals who represent the following areas you see here. The role of the review member is to review each case and identify ways in which a system could be improved to prevent flu hospitalizations. This could include identifying recommendations based on your area of expertise, your previous work in the system, your knowledge of the system, or your experience in the system, and/or a combination of multiple perspectives. The process. So we are hoping to review 15 cases of maternal influenza. We are seeking to get maternal interviews for all of those cases. However, we could likely review at least 1 or 2 cases that do not have a maternal interview as part of it. The committee will review each case independently. However, it is likely that we will start to see trends between cases as we move through them. Again, the focus should be on recommendations that can be carried forward into future work. We've hired 2 abstractors for this project that are charged with abstracting the cases and conducting the interviews with women. They will also be helping to write the final report. These abstractors will be a part of our meeting and are available to help answer questions and provide clarification to the information that you receive in the case summary. With each case, we'll go through the following questions, and a copy of these questions will be available to you that day for reference. Part of the usefulness of the FIMR process and the maternal mortality work even that we do is the rich discussion that results from reviewing the case as a committee of experts. These questions are put forth to help guide the discussion, but they're not meant to hinder your conversation. Part of my role in the process is to facilitate the conversation to ensure we stay on topic and within our time limits, but also to think through responses and to reach the recommendations that we need. So as I mentioned before, the focus of these reviews will be on population-based efforts to prevent future hospitalizations due to flu. It can be hard to wrap your head around what is meant by population-based, especially when we are reviewing individual cases. This pyramid was developed by Thomas Frieden, and I think it provides a great visual to describe population-based efforts. The article from which this pyramid comes from acknowledges that comprehensive public health programs should generally attempt to implement measures at each level of intervention to maximize synergy and the likelihood of long-term success. For this project, we will be looking at recommendations that speak more to the system improvements that can be made versus individual behavior changes. So part of this project includes confidentiality. So committee members are volunteers of CDPHE. This means that you are not employed as a member or a staff member at the health department, and thus you do not have government immunity. Therefore, all information shared with you will be de-identified per HIPAA, and it will also not contain any information that could identify a hospital or a provider. We do ask that all pieces of information with case identifying parts on it, including notes that you may take on cases, must remain in the room that day. When you arrive on June 27th, you will sign 2 confidentiality agreements, one for CDPHE and one for ACOG. And we also ask that you agree not to discuss or share case information outside of the committee meeting or with any unauthorized individual. And just as an FYI for you, this meeting will be closed to the public. It will operate similar to how our maternal mortality meetings operate. We operate as closed meetings, meaning that we do not announce the meeting publicly. We do not invite members of the public to come to the meeting, and we do not release that information that is shared in the meeting to the public. So what if I recognize a case? So we know that there were not many pregnant women hospitalized with flu in Colorado during the 2012-2013 season. So there is always a possibility that you may recognize a case, even with the great length of confidentiality and redaction that happens with it. Recognizing a case does not prohibit you from participating or reviewing the case. We do ask that you refrain from releasing additional pieces of information that may inadvertently disclose a patient's identity. So please do not release anything that you would not release as a member of your own agency. And we also ask that you do not share or discuss committee conversations with individuals outside of the committee who are unauthorized to receive such information. So just as a reminder, here are your meeting logistics. We are meeting on Friday, June 27th from 8 a.m. to 5 p.m. and I will make every effort to get you out before 5 p.m. If you do need to leave early, that's completely okay. Please just let me know so that if we have specific cases that we want your expertise there for, we can make sure to review them while you're still with us. It will be in Sabin Clear in Building A of the Colorado Department of Public Health and Environment. And I have provided you a map in the email that has also contained this video. There will also be signs up that day. And as a reminder, we do have funds available for mileage reimbursement, hotel, and per diem. Mileage reimbursement is for everyone. Hotel and per diem will be for those who are traveling long distances. We are heading up against our fiscal year end, which is June 30th. So in order to be reimbursed in a timely manner, I will need you to submit your information to me on June 27th. For most of you, this will include a completed W-9, the mileage reimbursement form, and a copy of the Google or MapQuest map that reflects the mileage you are seeking reimbursement for. For those seeking a hotel reimbursement, please remember that you must submit a $0 invoice, meaning a copy of the invoice from the hotel where it shows that nothing is due. If you do not provide me with this information by June 27th, you will likely not be reimbursed until early to mid-August, and there's not much that I'm able to do about that on my end. I have reattached the W-9 and the expense reimbursement form to the same email from which you got this presentation. And so this is the proposed agenda for the day. We'll spend the first part going through just a brief welcome, introductions, and just some ground rules of how we choose to interact with each other throughout the day. We will then review cases, and I do have breaks noted throughout the day, and we'll make sure that we honor those breaks. We will have a lunch from 12 to 1, and we can decide if we want to make that a working lunch or if we want time to step away and take a walk outside, check email, things of that nature. We are expecting to review about 15 cases, as I said, and we've allocated approximately 25-ish minutes for the review and discussion of each case. So this time has not been arbitrarily chosen. It's actually based on our maternal mortality work. And we found that after a certain point, the discussion starts to dwindle off or it starts digressing towards a different topic or focusing in on a specific provider action or something that's not related to the purpose of the review. So not all cases will take this long. Some cases might take a bit longer. Some cases will be much shorter. However, we will try to keep a timely flow of the case discussion throughout the day so that we can get through the work that needs to be done, as well as get those recommendations on the table. And so if you have any questions, my information is here, as well as my cell phone. If you have any last minute crisis that happens or you're running late in traffic, please feel free to text or call me that day and just let me know. And I look forward to seeing you all on June 27th. Thanks.